Hi, everyone, and welcome to this morning's session of School-Based Health Centers, Resources, Training, and Technical Assistance. Today's session is called Power Up, Strengthening Your Gen Z Practice. I'm Andrea Shore with the School-Based Health Alliance, and I'm introducing this morning's speaker, Dr. Jennifer Salerno, who is the CEO of Possibilities for Change. Dr. Salerno possesses over 25 years of experience as a pediatric nurse practitioner and translational researcher within the field of adolescent risk and prevention. Dr. Salerno has worked in partnership with clinicians, researchers, and youth to develop and evaluate technology-based youth risk screening and coaching tools. In tandem, she has created e-learning and live workshops designed to equip professionals with motivational interviewing strategies to improve the quality of risk reduction coaching provided to youth. Building on her motivational interviewing work with professionals, in 2016, Dr. Salerno released Teen Speak, a how-to guide for understanding and communicating with your teen to equip parents with communication strategies that foster strong family relationships, a key factor in improving youth risk. I'm now going to turn it over to Dr. Salerno. Please welcome her with me.
Great. Thank you so much, Andrea. I'm excited to spend this time with all of you today. What I'm going to share is really to help strengthen that communication and connection with the youth that we work with. Now we're called Gen Z. So we're going to spend this time together talking about two technology-based systems. One is screening. So if we look at identifying youth risk, the RAP screening tool, I'm going to share some information regarding that and the use of technology, what that looks and feels like. And then once you have that information, once risks are identified, a lot of times as professionals, we think, okay, what do I do with that information? So what we have developed is a technology-based motivational interviewing training that has been shown to build skills and your confidence in how to respond to the various risks that we might be encountering, whether it's with a screening tool or just youth coming down to talk with us in school-based health centers. Having both of those strategies and skills is really what's going to improve the quality of youth services and ultimately their health and well-being. So I want to use chat along with providing some information to you so that you're a little more involved in this session. So if you can look on your app, if you're on an app or you're on your computer, look for the little icon that looks like a text icon for chat. And what do you think related to teen deaths? What percent are directly related to risk factors? And risk factors like unintentional injuries, like suicide, motor vehicle accidents. What do you feel like is the percent of teen deaths related to risk? And I see some of you found the chat, so appreciate that. I see some 70s, 60s, 80. Perfect. 50%. So look for the chat because we're going to use it as we go along today. So what it is 75%. So 75% or 3 out of 4 teen deaths potentially could have been prevented with our opportunities to identify risk, to provide some resources, to provide some communication, really connect with youth to try to reduce that number. That's really our goal in school-based health centers. So if we think about the information that we have on our youth population, our student populations, with the RAPS risk screening tool, we have anywhere between 50 and 75,000 surveys completed annually and are able to kind of look across the US at what's happening with youth risk. So we have about 32 states and over 500 different types of settings using RAPS, school-based health centers being a big component of that. So we're able to look across at risk. So what you're looking at here are the top 5 risks that youth identify in RAPS. So no helmet use is the highest risk, and those are youth that are actually, riding or using something, doing something that would keep them safer if they wore a helmet. Then we have sexual activity, unprotected sex, which is extremely important now with the changes that are happening related to sexual health services across the US. And then you'll see those mental health pieces like depression, anger management, and anxiety. We're looking at 2021 data, this is 2020, and see significant increases, which I'm sure you're seeing as well. So it's really, really important that we're screening for risks, then able to kind of dig deeper. So once we screen for risks, what else is happening that is going to or is impacting that risk? So when you have a tool, whether that's RAS or another that you're using in technology, you're able to dig deeper. So what we've found is that for those students reporting depression, 1 in 4 also report being bullied, which is impacting that depression. And then out of those students that were using some type of nicotine or tobacco, 79% of them used a vape device in the last 3 months. And then we're able to look also at sexual activity by age and really kind of pull out what percent of youth by age are reporting sexual activity to be able to see, okay, where's the most significant jumps and how might we address that in the services we're providing, in the additional maybe group interventions or interventions after school that might impact some of this data. So we're talking about overcoming barriers in this time together. What are some of the biggest barriers you have to identifying risk and then coaching youth in that risk reduction? So using chat, what are some of your biggest barriers? And as you're responding in chat, I see a question, who is responding to the RAPS survey? So the RAPS, which I'm going to share right after this piece, is for youth 9 to 24. So youth in that age group are responding, and the settings that they're responding in are primary care practices, school-based health centers, after-school programs, community-based organizations, pregnancy prevention programs, juvenile justice. So there's quite an array of youth that are responding. So some of the biggest barriers, trust of adults, youth wanting to talk about it, the confidentiality, definitely, them worried that their parents might find out, them feeling comfortable. Absolutely. Yep. We want kids to be truthful. We feel like they're not always there. Yep. No trust. And time always comes up as well. So thank you for responding in there. So we're going to talk about 2 ways to kind of overcome some of these challenges. The first is to ask the questions in a way that youth understand, that they're more honest when they're responding, and then listening and using effective communication strategies. So I'm going to share some information about both of those pieces. And then I have here a quote from one of our RAPS users that they were seeing a student for quite some time. When they implemented RAPS, that student flagged for suicidal ideation. And when they came back in and said, hey, how come you never shared that before? She answered, no one ever asked me the question. So we know that youth are very dependent on brain development, how they interpret things. They're very concrete thinkers. So it's really important that you're using tools that are validated, that can connect with youth so that they do respond honestly, because that came up a lot in some of the challenges that you typed into the chat. So we know technology connects us with youth. The youth that we're serving now have grown up in technology. They've pretty much used it since they were babies. So using technology can really help connect with them right away. Some of the barriers that you mentioned are that youth just aren't comfortable, that they don't feel like there's a connection. So technology can help really bridge that gap pretty quickly. Thinking about the RAPS, a little bit of background. RAPS was developed at the University of Michigan with a team of multidisciplinary clinicians and researchers, as well as youth in the age groups of 9 to 12, 13 to 18, and 19 to 24. So everything that we've developed, from the question content to the look and feel of the technology, has involved youth to ensure that they feel the most comfortable, that they understand the questions that were developed. The RAPS itself is validated as both a time efficient and effective comprehensive screening tool, and also as a youth depression screening tool. So a lot of settings that are using the RAPS are using it as their comprehensive and their depression screening tool. It's just 21 questions, takes them about 5 minutes, so it's not as impactful on time and workflow, and is identifying risk in the 6 categories that the CDC notes as contributing most to morbidity and mortality in youth. There's different versions of RAPS. There's an older child or early adolescent, 9 to 12, the standard RAPS, 13 to 18, and then a young adult version, 19 to 24. We also worked with the American Public Health Association to create a version of RAPS that includes a question set of social determinants of health, and that's 32 questions. And then we have a version of RAPS that's just the mental health and substance use questions that are 9 questions. For school-wide screenings, it's typically used for health centers that are very focused in, or programs, expert programs that are focused in on just that mental health substance use piece and don't want to add in that comprehensive risk categories. This is the look and feel for youth when they're completing the survey. So I wanted to give you an idea of what that looks like, because when we think about using technology for screening, we think about like Qualtrics, we think about SurveyMonkey, and this is a very different approach to really connect with youth, help them feel more comfortable in answering questions, especially questions that feel more sensitive. So we have used an approach that embeds digital empathy. So that's the look and feel to create a caring, comfortable, supportive environment as they're going through. So you can see here, they just have one question at a time, that the font and colors look different. There's an image next to each question that relates to the content of diverse adolescents in those age groups. So it really creates that environment so that they are more honest. If you look at research, they're more honest using this approach versus a typical technology approach or a pen and paper or interview style approach. Then when they complete the RAPS, they see what we call brief interventions. So these are health education that was developed based on evidence that shows that the most effective messaging to youth includes ideas for behavior change. You can see the bullets here, and a self-efficacy statement, a statement after the message. They really focus in on how to get help and or reduce the risk, depending on if it's a risk they're experiencing or that they're choosing to engage in. And then you'll see resources there at the bottom of that message that are national or government websites, specifically for teens around the content of that question. And then when we did focus groups, youth asked for hotline and chat numbers, which are included depending on the content area and what we could find. And then as part of the professional review, the RAPS report is accessed with just a click. You can see here, you'll have flags for those questions that are highest risk that the CDC notes that impact morbidity and mortality the most, the moderate to low, and then there's some protective factor questions. You'll see a score, total score, the mental health score, because a 2 or higher equates to a PHQ-9 positive response, and then a substance use total. And then the questions that were answered as a risk will be in the next section to make it easy for you to review, to note what questions need priority over others. And then you can click an information button that will pull up that health brief intervention or the health message so that you can use it as a jumping off point. So you never have to feel stuck like, oh, where do I go from here? How do I talk about reducing risk with these different categories? That will give you kind of that jumping off point. And what we've heard from different providers that are using the system is that this is a really nice way to help youth be prepared for a conversation, that they actually are reading the health messages and have questions, and the conversation flows a lot smoother when you're using this type of starting point, jumping off point. So let me look and see if there's any other questions. Where can we find the RAPS? So I'll show you all of that at the end. RAPS does interface with EMR systems. So we're able to provide that interface so that you can just work in the EMR, then youth see, the look and feel for youth is the same, and then this report can push as a PDF to your EMR, so you don't have to use two different systems. And then it looks like Jessica put our website in the chat, so if you want to take a look, and I'll have it at the end as well. So part of using technology is really accessing the data that you have. And with school-based health centers, it's so important to showcase what we're doing, the needs of our population, to really dig deeper and figure out, what are some of the inequities in our population, who's at highest risk, and then are you making a difference over time? So the system has really been set up to allow you to answer those questions with a click of a button. So we have different types of reporting. Site metrics and demographics are pretty straightforward. You should be able to get that out of any system that you're using, like how many surveys were done at each location or school-based health center within your organization, what's the population that completed surveys. But then what we've done is really gone back to those questions. So what are the greatest risks in my population is a common one. So this report takes all of the RAPS questions and ranks them based on the question that's answered as a risk the most at the top down to the least. So it gives you a very quick view of what's going on in your population. You'll know with data, not just kind of your thoughts and stories, but having the data marry that piece is a really powerful story then that you can tell. So this is the percent of our population that's at risk for each of those questions. And then here's some of the ways that we've been able to impact that. So this report will tell you that you can filter by any of the demographic categories if you're interested in a specific subset of your population. You can also filter by question. So this allows you to really dig deeper and determine some of those inequities that are happening within your population, some of those subpopulations that are at highest risk. So what I've done here is pulled out and filtered by the question around being discriminated against. So feeling stressed because someone's treated you differently. Now the rest of the risks are filtered for only those youth that responded positively to this risk. So what it does is it allows you to compare your total population risks to then just that subpopulation to really identify those youth that need more services, maybe some follow-up, that sort of thing to use for grants, anything like that. And then any of the reports, the bar that you see, if you click on the bar, it gives you a list of who it is that's at risk. So it answers that question. And a lot of organizations and school-based health centers use this report to case manage students, make sure you're following up with students that have particular risks, maybe to target those youth that would most benefit from participation in a group intervention or health education. So maybe you're facilitating nicotine cessation group and you want to target youth from the list that identify using nicotine, maybe a depression group. You can use it for CQI projects. If you're doing school-wide screenings, this is the report they use to follow up with those students that responded positively to the question around self-harm and suicide. So there's a lot of different ways that you can use this information. And then the last report that I want to show you is really that risk change over time. So this is sometimes hard to get to, especially in prevention work. So what kind of change have we been able to make over time, that positive change? So this report will show you youth that completed more than one RAP screening within the time period that you choose. So typically you're doing RAPs annually. So if you choose a 15-month time period, it'll pull in all of those youth that completed the survey twice in that time period. And then by question, what youth, the percent and the number of youth that were at risk in time one, and then how many of those remained at risk or improved, didn't report that risk in time two. So it's really a one-to-one on each question so that you can see, okay, we knew they had a risk in time one. Everyone has different types of risk reduction counseling, referrals potentially, interventions and resources within their health center. And then in time two, how many of them remained at risk and how many of them improved. So it's a really nice report to try to start getting to the outcomes that we have and the work that we're doing and be able to showcase that. So let me see if there's any other questions before I move on to talk about motivational interviewing and the technology-based skill building course that we have and just MI in general. So are there any other questions about RAPs before I move forward with that? How frequently is it administered? Usually that is annually. Sometimes programs will administer RAPs at the beginning and end of the year or at the beginning of some type of intervention and then at the end so that they're able to show and use that report that shows change over time. So it's really a protocol dependent on your health system or your sponsoring agency. So let's move on to risk screening or post coaching because I want to make sure that I share that information. So how many of you are experienced with motivational interviewing? And you can just say A, B, or C in chat. So motivational interviewing, like minimal to none. I don't really know what that is. Sometimes people think it's motivational speaking, which is not the same thing. It's more of a communication theory and strategies. You've attended a training or two, or you use it routinely. So if you can say that, I have some A's, a lot of B's, a couple C's, which is great. All right. So this will be a really nice introduction for some of you and a refresher for others that have attended some trainings or use it routinely. And then I can share some information related to the online course. So why motivational interviewing for adolescents? It really takes all the pressure off of you. So as professionals, we feel like we need to have all the answers. We do a lot of the talking during visits. We do a lot of suggestions or advising, but developmentally, youth are in a stage of wanting more control and respect. So a lot of times that approach doesn't work. So motivational interviewing has been researched in adolescents and been shown to be extremely effective in talking with youth about reducing the risk in all the different risks that you're screening for, as well as working with them on taking medications as directed and some other health related goals that you might have. It really allows them to drive the process and them to say and tell you kind of what they need and what they're going to do to move forward, which is helpful in them actually taking steps. So motivational interviewing is really a supportive communication strategy. You can use it with everyone, so colleagues, partners, spouses, friends. It's not just about the youth that you're working with. It was originally developed for use in substance abusing adults. So There's, lots of different evidence and use for it, but it's just a really nice communication style. And the strategies can be used pretty much in any situation. So there's two components I'm going to bring in and talk about today. One is the spirit. So, how are we setting that stage? A lot of the challenges that came up earlier, you were talking about just comfort and youth being, uncomfortable. And some of that has to do with how we're approaching them. So thinking about using motivational interviewing to help develop that spirit or kind of that environment is a really nice way. And then I'm going to bring in a few strategies so that you understand MI and then have an idea of what the course might include. So the spirit is really about talking with and not at. Sometimes we need to ask closed-ended questions, especially if we have a screening tool and maybe we're verbalizing that information and we're asking, are you drinking? So instead of asking it in that way, because we know automatically what our youth telling us, oh no. So they know the answer that we want to hear from them or we're hoping to hear from them. So if we change up that approach in the spirit and say something like, I know it can feel uncomfortable, and I have sex as the example here, so apologies. So we might be like, are you having sex? And then the talking with would be, I know it can feel uncomfortable talking about sex. Knowing a little more from you helps me figure out what you might need. So a lot of times youth are like, why are you asking me all these questions about my sexual history? Like you're trying to be in my business. So up front, instead of just asking them questions, saying like, hey, I know it can be uncomfortable, but knowing a little bit from you helps me figure out like, do you need some tests or how can I help you be safer? You're not vaping, right? Sometimes we ask questions that are leading that really kind of help you tell us the answer that we want to hear. So instead of that, saying something like, there's been a lot of information out about vaping, a lot of talk. How do you feel about it? Getting from them, then they'll share with you what some of their thoughts are, whether they're using or not. And then you can see some other examples here. You need to take your meds every day, or do you feel depressed? And the talking with, it can be hard to remember to take your meds, so you're coming in with some empathy. What do you think you can do to make sure you take them every day? And then with the depression, it's normal to feel sad sometimes. Tell me more about how you're feeling. So that's the difference, kind of the spirit between kind of a normal or typical way that you might ask a question, or you might hear questions being asked, versus thinking about using strategies in a way that helps with that communication and that relationship with you so that they're more comfortable and honest. So I'm going to dive into some open-ended questions, affirmations, and reflections. So open-ended questions, those are, you know what that is: who, what, when, where, how. We have to be careful with why, because it can feel very judgmental if we're asking youth why. What I found is that if you use a starter, like you see fully open-ended questions here, like, help me understand why you haven't been taking your medications. Takes the why haven't you been taking your medications, takes why off the first word. So just adding that piece can take off the feeling of being judged. And then additionally, changing a why to a what can typically be easy to do. So why aren't you taking your medications? What's getting in the way of taking your medications? So thinking about it in that way can be helpful. Then if we're looking at those fully open questions, because sometimes that who, what, when, where, how, and even the why can elicit like a, I don't know, or 1 or 2 word answer. So using more fully open questions can help elicit more information. So questions like, what you see here, what do you think about, tell me about. You can add anything into those. Like, what do you think about wearing a helmet? Tell me about your experiences with, and you can put anything in there. How do you decide when to use a condom and when not to? I use that a lot in practice because we'd have youth come in, or my patients, and be like, oh, I use condoms sometimes. So instead of just jumping in right away with, information about why they should use them all the time, and giving them suggestions. How do you decide when to use them and when not to? Helps me understand where they're coming from. Is it that they don't want to, or they just don't have access? So it can help guide the conversation. And then they're telling me what they need, and then help me understand. We talked about the key questions helps you move to that planning piece. So these questions I really like. They can be like summaries, given what you told me, what do you think you'll do next? Where do you want to go from here? What if you tried not smoking marijuana one day a week? If it's someone that's smoking every day, what would it take for you to be worried about this? So some of those times when you're feeling resistance or you're feeling stuck, these key questions can help get you out of that, and you talking more about what it would take or what would it look like if they tried to make a change. So then try that out. So instead of asking, are you drinking? How might you rephrase that using some open-ended questions or question starters? Any ideas in chat? So instead of saying, are you drinking? How might you word that? And I can go back to some of these fully open questions. Who, what, when, where, how. Thinking about it more generically. What are the causes of you drinking? What do you think about drinking? How do you feel about drinking? Yep. Tell me what you think about drinking. Thinking about those resistant pieces, what would it take to not drink if you were offered alcohol? Or what would it take for you not to drink at the party this weekend? Yep. What do you think about drinking? Yeah. You're all great. How does drinking make you feel? Yep. Perfect. So I'm going to jump into affirmations. So we're just doing some real brief pieces so that you have an understanding, especially if you've not been exposed to motivational interviewing in the past. So affirmations are also a really important part of engaging teens and building trust, because teens who are told or they feel like they're not good enough are more likely to use substances, report depression and anxiety, have sex at an early age. So we want to, that's what we're working on trying to reduce. And we know youth live up or down to our expectations. So if they're always told that they're not good enough, then they're likely to be engaging in more risk. And we really want to empower youth and their families. So affirmations start with you and not I. They're very genuine and specific. So they're not compliments, but we're really trying to find youth's strengths and reflect that or state that back to them. So we're using I statement, or we're not using I statements, we're using you statements. So if I said to you, if we were working together and I said, I think you're a fabulous provider in school-based health centers, or you are a fabulous provider in school-based health centers. The I makes it so that you need to be around me in order to feel like that. It's my opinion. When I take that off and just say you are, they can take it in more and try to build up, you're trying to build up their self-esteem and self-worth, their strengths, so that they feel like they have what they need in order to make safer decisions. So it's kind of works in that way. So some examples for you have, you are, you feel, you believe in creating affirmations might be, you have a plan for quitting vaping. That's a strength. You have a plan for quitting. You're way closer to actually following through with that plan and actually taking steps. You're committed to exercising 3 times a week, or you feel in control when you take your medications every day. So you're acknowledging those strengths, like you feel in control, so that they have some motivations for continuing to feel like that, or you believe in taking care of yourself and your partner. So if you're talking about using condoms, you believe in taking care of yourself and your partner can really be a motivating factor. That's a strength that they have. Like, oh yeah, I do. So I want to continue moving in safer, making safer decisions. So I know we're going through this pretty quickly, so I just want to give you an idea of the different components, because the online course includes all of these in much greater detail and with a lot of different activities so that you can start to use it and incorporate it into your practice. So creating an affirmation. So if we heard, I want to control my anxiety, but I just haven't found something that works. When I hear that as a nurse practitioner, I want to jump in and help. Like, we want to fix it. So let me give you some ideas for things that might work. Definitely we'll get to that, but starting with an affirmation first can really help set the stage to that youth then being engaged in the conversation, talking with you about what they need, and then making some decisions, versus if you jump right in, they may just start tuning you out. So how would you create an affirmation using you have, you are, you feel, you believe, if you heard this statement? I want to control my anxiety, but I just haven't found something that works. And as you're thinking about that, Lucy has made a comment, using affirmation also helps enforce the power of positive thinking, definitely. Because we're our own worst enemies, especially teens. All they do is tell themselves continuously that they did something wrong or they're not good enough. So it definitely helps that positive thinking. You've taken the first important step. Well done. Yep, perfect. You've taken that first step. You have the ability to make healthy decisions. You've already started. Great job. They want to control. They've already started. You're doing a great job wanting to do that. You're brave to bring this up with me. Definitely. You've taken the first step. You're doing great. Thank you for opening up. All of those things are really important in establishing that relationship. You might say some things very specific to the anxiety. You've thought about ways to control your anxiety because they said, I want to control, I just haven't found something that works. So they've thought about different ways. You're committed to controlling your anxiety. So now you're assuming some things. You feel in control when your anxiety is lower. And you believe in taking care of your mental health. Great. You have a desire to control your anxiety. That's such an important step in continuing to look for something that works. That's great, Jody. Okay, so then reflective listening. Finally, we're to this strategy. It's a little more difficult to master, but it's one of the most effective when communicating with youth, because it doesn't feel like you're just asking questions. They don't feel like you're grilling them, yet you're getting to the same place with statements versus questions. It's really stating back what you heard and then adding an emphasis, maybe an additional meaning or a continuation of their thought. So it's very different maybe than how you've been trained. As a professional, it was definitely very different when I went through nurse practitioner school to, never make an assumption or add, onto their thoughts. But it's a very powerful communication strategy. So if you have youth tell you, I've tried using condoms, it just never works out. So instead of jumping in to ask questions or try to help them fix that, some very simple ways to reflect are what you see here. You've used condoms in the past. Sometimes it feels like, why would I just state back to them what they said? But one, again, it establishes that, helps solidify that relationship, and also lets them know that you hear them. You're not just trying to tell them what to do. And then they'll elaborate. You used condoms in the past. They'll be like, oh, yeah, this happened, that happened. You might rephrase, you're having sex and not always using protection. So then they might share with you, like, what are the times that they've used it? What have they not done? Because what happens is whatever you end with in talking with someone in a statement is what they'll continue to talk about. So depending on how you reflect, you might hear different things. And when you really dig into motivational interviewing, being very deliberate in your reflections can help get you to that safer behavior discussion much, much faster. You might say you'd like to be safer when having sex. So now they're going to tell you what their motivations are, what they would like their goal to be potentially, or you might just reflect a feeling. It's scary to think about getting an STI. So reflecting a feeling then can also help them start thinking about, okay, yeah, that is scary. I don't want to be worried about this. And that's motivation for safer behaviors, whether that's testing with you, whether that's committing to safer sex when they decide to do it. So I wanted to give you kind of an idea of what motivational interviewing is. What we've done is created a skill building course. So as part of my doctoral work, I created a workshop for professionals specifically around adolescent risk in using motivational interviewing strategies. And that has been validated as effective in improving skills, improving confidence, and just knowledge of the different types of strategies. So since that time, we've kind of evolved in the workshop being part online course and part in person, whether that's virtual or live face-to-face, in really honing in those strategies. And then recently, we've done some work on establishing the online course as being effective in building skills and increasing confidence. So this is a course that's accessible 24/7. It provides a very dynamic and engaging experience. So there's real life examples as a professional working with youth. There's lots of different activities. So you're not just watching a webinar or me like talking with you and flipping through slides. So there's an avatar that walks through it with you, lots of activities, different videos in there, knowledge and skill checks. And it has with it 8 continuing education credits for physician, nursing, social work, health educator, and teacher. So if you're interested in that, I can definitely send some information. Also, you can go to the Possibilities for Change website. I know it was in the chat earlier, because as we're coming back now to where we started, that validated risk screening process, particularly if you're using technology, we also license reps to put into your own EMR if you just want to put it in as a form or use it as a paper-based survey. You can choose, whatever format works best for you. The technology is obviously the most effective and engaging for youth. And then kind of pairing that with staff that are feeling equipped to have those conversations, no matter what has been identified by youth, and really feeling more effective and confident in those discussions or risk reduction coaching that you're providing. That's what's going to increase the quality and just improve youth health and well-being in general. So I want to thank you for joining me today, learning more about the technologies that we have. There's lots of other opportunities as well. If you want to go to the website or email me directly, I'm happy to share some information or set up a call and talk through, whatever it is that you might be interested in. And then if there's any other questions, let me know. I can kind of look here too.
Thanks, Jennifer. I do see one other that came in. One question at the end was, as a health educator, does it include CEs for CHES?
So yes, it is the CHES credits. Yep.
Wonderful. Any other questions? I'll give another minute in the chat. This is wonderful. I did see one earlier, Jennifer, but perhaps they can just do it through contacting you. It was about whether the product, the WRAPS product, was free or at cost, or if it had cost.
Yep. So the technology, we're really a social enterprise. So our costs are very low, but we do have a cost for the technology and a very low cost for the paper. So if you want to reach out to me, I'll ask a couple questions of you, and then we could provide that information. Yep, that Jay Salerno. And I do see some of you have requested information on that MITEY Change I may or may not be able to pull that out. If you could email me that J and then Salerno at pausforchange.org, then we'd make sure that I can get that to you.
Yes. I think that's a good idea. We'll leave the screen up for a couple minutes too, so everybody's writing that down. Absolutely. Wonderful. Just give it another minute to see if anything else comes in the chat. This is great. Thank you, Jennifer. Oh, can you explain the interfacing with EMR?
Yes. So the interfacing with an EMR, that really depends on the system that you have, how easy or difficult it is. But what happens is you assign the survey typically through your EMR. You would choose it maybe in a patient portal or somewhere, depending on what EMR you're using. Once that's assigned, a link is sent either to that youth by cell phone, email, or to a device that's in your office, like an iPad. The youth completes it. They see everything that I showed you, one question at a time, the health messages. Once they complete it, that PDF populates of the report, and that then gets sent directly into your EHR to a designated location, whatever you designate as the location. Sometimes people designate it into the like a place where scanned or versions of PDFs are coming in different ways. Sometimes it goes directly to that patient's area. Sometimes it goes in a prevention tab or a screening tab. So it really depends. But basically, youth will complete, you'll assign it through your EMR. That tells our system to send the link, whether that's device or other ways. The youth completes it. That report populates and a PDF goes back into your EMR. So you just work in the EMR, but our system is transferring that information back and forth.
Great, thank you. And then another question, is it available in multiple languages?
English and Spanish is what we have right now. And then what I didn't mention, I don't think, on the when they see one question at a time, there's a speaker button so they can listen to the text. So that helps to overcome some like written literacy issues that might be within certain populations. And also for engagement, like some youth just like to listen.
Great. Okay. I don't see anything else that's come up. So we thank you so much for your time today, Jennifer. This was fabulous. And hopefully everyone got down this information, but also like posted in the chat at the end of the conference. These will all be available on our website, and the slides will be there as well. Oh, I do see one more question that came in. What's the health literacy level of RAPS?
So depending on how you're using it, the literacy level is around a 5th to 6th grade. So using that speaker button really helps so that they can just listen and you don't have to worry about the level of them reading. But if you're using the content, the paper survey, it's a 5th to 6th grade average. Some are a little bit less, like 3rd and 4th grade, depending on the question.
Thank you. Okay, see lots of thank yous, and thank you, Dr. Jennifer, in the chat. So thank you again for your time, and appreciate it. And we will see you all soon. Our next session begins with a plenary. Our first plenary session of today begins at 12:00 p.m. Eastern Standard Time in a little less than 15 minutes. So hope to see you all there. Thank you all.
Thanks, everyone.